Good evening, all.
Good evening, sir.
All right, you're welcome to our today's class. We are still on the course, BDT 253, Pharmaceutical Calculations. And we are still doing our review, NPCE review. 2026 NPCE review. So we'll start from where we stopped yesterday. We'll start from where we stopped yesterday. Yesterday, we were solving a question, or we solved a question on isotonic solution, the one that involves dissociation, that is I factor. Excuse me. The one that involves I factor, that involves sodium chloride, which is a 2-ion electrolyte, sodium chloride solution, which is a 2-ion electrolyte, in which sodium chloride dissociates, has 90% dissociation. And we calculated, before solving the question, we first of all calculated the I factor, which we got as 1.9. So having gotten the I factor, we then move to finding the freezing points. And I said that I was trying to explain something different between freezing point depression and freezing point itself. I think that's what I said I will explain today. The calculation was straightforward, but you need to understand the difference between freezing point depression and freezing point. So if you say freezing point depression depression does not have negative signs. If freezing point depression talks about the magnitude of the depression caused when the solute is added in a solvent to form the solution. And I told you that for a liquid, test of purity for a liquid, you use freezing point. You can also use boiling point. These properties we use for solution are called colligative properties of a solution. They depend on the concentration. Colligative properties of the what? The solution. You see that more in the physical pharmacy or physical chemistry. Colligative properties of a solution. It does not depend on the type of solution, the nature. Are we together?
Yes,
Okay.
sir.
To drive, let me not talk much. To drive this home, this back, to drive this point back, can someone check up colligative properties of a solution? Do it now. Colligative property. Fast. Colligative properties. Someone should do it fast. Check up colligative, the meaning, and so some of the examples. Colligative properties of a solution. Do it now. What does it mean? Colligative property of a solution. Do it now, fast. I give you 30 seconds. Just if you find it, just read it for us. Someone should do it now, fast. Before I continue, I think let me make it a collaborative class now. So you can enter where someone should, not even someone, just check up colligative properties of solution. Have you seen it?
Yes, sir.
Read.
Colligative properties are the properties of a solution that depend only on the number of solute particles present in the solution, not on the nature or identity of the solute.
Does it make sense now?
Yep.
Examples.
Yes. They have relative lowering of vapor pressure. I don't understand that one.
Yeah. Don't worry. Good. Next one.
Elevation of boiling point.
Good. Next one.
Depression of freezing point.
Good. Next one. Osmotic whatever.
Osmotic pressure. Yes, sir.
Good. Next one.
Sir, it's only 4.
Okay, 4. Good.
Yes.
Now, good. It's okay. Now, did you hear freezing point depression there? Or lowering?
Yes.
If it's whenever you hear depression or freezing point, I mean lowering or the freezing point. Now, whenever a solute is added, normally solvent like water has a freezing point of 0. Ordinary water, which is solvent, has a freezing point of 0 degrees Celsius. This is the freezing point. This is the level of the freezing point. And anything less than 0 degrees Celsius is minus 1, minus 0.1, minus whatever. Then anything above is positive. Now, this is the freezing point of water. But the moment you add a solute, like sodium chloride, and it dissolves inside this water, if the freezing point of the solution formed will not be 0 again. The freezing point of the solution formed will come down to, depending on the concentration, will come down to, let me assume 1.86 degrees Celsius. Let me assume this. It moved from 0 degrees Celsius to minus, not 1 point, it's minus 1.8. Have you now seen that? This is when it was only solvent. This is the solution formed. Has the freezing point of the solution formed? Has the freezing point of water been depressed? Has it been depressed?
Yes.
Good. It has been what? Depressed. Now, if they ask you, what is the freezing point of the solution? Simply say minus 1.86 degrees Celsius. But if they ask you, what is the freezing point depression? What is the freezing point depression? You do 0 minus 1.8. From here, this minus initial, this thing minus the final one, depression. Now, this depression will just give you the magnitude, just the magnitude. Here, from here to here is the magnitude between what is it between here and here is 1.86 degrees. Is that clear? So you simply say that it depressed, the freezing point of water here has been depressed by 1.86 degrees Celsius. The freezing point has been depressed by 1.86, not minus, no. But if you want to be specific on the freezing point, new freezing point of the solution formed, you say minus 1.86 degrees Celsius. Is that clear?
Yes, sir.
This was what I was trying to explain yesterday when Damian asked the question. So that's why I told you that this question number 12, can be twisted. Can you hear me?
Yes, sir.
This question number 12 can be twisted. If this question number 12 is twisted, The answer can be A, which is 3.53 degrees Celsius. Let me now know whether you understood what I explained. Tell me how the question can be twisted for the answer to be 3.53 degrees Celsius. Go back to question number 12. Then tell me how you can twist that question for the answer to be 3.53 degrees Celsius instead of minus 3.53. Based on what I just explained now.
That's if you are solving for asked to solve for freezing depression, sir. Right?
Good. Let's assume the question was you were asked to calculate the freezing point depression now. That's when you can become what? 3.53. But the question says calculate the freezing points of a molar solution of sodium chloride. The freezing point. That's why it is minus. Is that clear? Is that clear?
Yes, sir.
But remember yesterday how we got minus 3.53. We said that freezing point here is equal to minus 1.86 times the I factor. Remember? Hope you can remember. This thing is constant. The I factor is based on the nature, the electrolytes, the I factor of the electrolytes. And this I factor of the electrolyte is depending on the concentration of the particles. And it's this concentration of the high concentration of the particle that will exert osmotic pressure. Because the number of the concentration is much, so the I factor will be much. Let's assume, and because why the concentration is or the particle is much was because the dissociation in the question is 90%. Let's assume that the dissociation is just 70% for some ions. In fact, some electrolytes, their dissociation can be just 40%. This happens in something like even there are some even zinc. Sometimes you see depending on the nature of the zinc, whether it is zinc chloride or so. Of course, zinc chloride is a trivalent ion. When you see that the dissociation constant is percentage dissociation is low, the number of particles will be low and the I factor will be low. Is that clear? We have dwelled so much on this question. Let's go to the next question. Question 13.
So please let Chinenye in.
Okay. Read question 13.
If 400 milligrams of a substance is used to prepare 10 ml of a solution, what quantity of the substance is needed to prepare 100 ml of the solution?
Okay.
So option A, 40 gram. Option B, 0.4. Option C, 4 gram. Option D, 40 mg.
So what's the answer?
4 gram.
How did you get 4 gram? Tell us.
So if 400 mg is to 10 ml, so how many mg is for this thing 100?
Okay.
So 400 times 100 divided by 10, you
Okay.
will now have 4,000 mg. But our answer is in gram. You will now convert it to gram.
Simple. Is there anybody in the class that you don't understand what she said? If there's anybody in the class, it says that the question says if 400 milligrams of a substance is used to prepare 10 ml of a solution, what quantity of the substance is required to prepare 100 ml of the solution. As she said, 400 milligram is required to produce what? 10 ml. So if this is the case now, how many we will require to produce 100 ml? We call it X. X is equal to what? This is simple. 400 milligram times what? 100 ml over what? 10 ml. May cancel ml. So this will give us what? 4,000 milligram. But we have to find it in where?
In gram.
In gram. We are really asked to find it in gram.
Yeah.
No, it's empty, not gram.
We are really asked to find it in gram.
No,
Okay.
sir.
No problem. We will not ask, but by the virtue of the nature of the options, is that clear? You will now move because the option has 4 grams. Is that clear? You move it towards gram because 1 gram is what? 1,000 milligrams. So if 1 gram is 1,000 milligram, therefore 4,000 milligram is. I'm breaking this down for our weaker brethren. It's equal to X. So X is equal to 1 gram times what? 4,000 milligram over what? 1,000 milligrams. So the answer is what? 4 grams. We were not actually asked to find it, but by virtue of the options, the option there, option C, there's no 4,000 milligram there. So the option C, you leave it as what? 4 grams. Does it make sense? So the answer is 4 grams. Next question. Any question here? Next question, please. Next question. Read.
Questions. Information for questions 15 to 19.
No.
Available in the dispensary was a 10 milligram
14.
hyoscine N-butyl bromide tablets. That's
question 14.
Oh, sorry. How many grams of dextrose are required to prepare a 400 milliliter of 5% solution? The answer is 20 grams.
How did you get 20 grams?
5% solution means 5 grams in 100 ml.
Correct.
Now, since 5 grams is in 100 ml, then X is to 400 ml. Now you do your calculation, you get 20 grams.
Perfect. It's straightforward, right?
Yes, it is.
Good. So let us not waste our time there. Go to the next question.
Information for questions 15 to 19. Available in the dispensary was a 10 milligram hyoscine N-butyl bromide tablets, that's popularly known as Buscopan. And the prescription below was received from a patient. RS, that's dispense. PO, tab, hyoscine bromide 20 milligram TID times 3/7. Question 15 says, what is the route of administration of the drug? The answer is B, per oral. That's what PO stands for. Then 16 is, what is the dosage form of the drug prescribed? The answer is tablet.
Okay.
What is the dose of the drug prescribed? 20 milligram is the dose.
From the question.
Correct. Check. I take a screenshot.
Continue. Sorry, continue.
Then, can you move up a little bit so I can see question 18?
Okay.
Number 18, the most appropriate way of expressing the dose frequency of the prescription is 3 times in a day, in every day. Am I correct?
What's the answer?
3 times every day. Wait. Hourly, sorry. That's the most appropriate way. 8 hourly.
But not 3 times in every day.
No, if you do 3 times in every day, you can take it at any time. Then 3 times in a day.
I like this question. Let's look at this question. Let's look at this question. The two confusing options here are option B and C, right?
I want to recognize this. I want awesome.
Hello? The two confusing options here are option B and C, right? 8 hourly and 3 times in every what? Day. 3 times in every day. Now, let's go back to the prescription. Remember, he said the most appropriate way of expressing the dose frequency of the prescription. Look at the prescription. The prescription says tablet hyoscine bromide 20 milligram TID. What is the meaning of TID? What is the meaning of TID? TID.
Child is 3 times daily.
Ter in deer. Ter in deer. Per in deer. Meaning 3 times. Is that clear? 3 times daily or in every day as they posted, as they said in the prescription, in the option. Now, does 3 times daily necessarily mean 8 hourly? Does it necessarily mean 8 hourly? Does it necessarily mean 8 hourly? I ask a question. Huh? Hello? Can you hear me?
Hi, yes, I'm here.
I said, does 3 times daily necessarily means 8 hourly?
Yes.
Do we have Latin expression for 8 hourly?
Do we have what? Sorry?
Do we have a way of expressing 8 hourly in prescription?
Yes.
Well, tell me, what is it? How do you do it?
Okay, let me do my show.
You what?
You? No. Sorry, I'm confused. Oba.
No, like now, in a prescription, now if they want you to give
Q8H.
keywords, keywords.
Q8H.
God bless you. Q8 what? H. So if the prescription really wants you to be 8 hourly, this is what you would have seen in the prescription. Is that clear? Is that clear? This is what you would have seen in the prescription. But if you see TID here, if you see TID, TID don't necessarily mean 3 times daily. Sorry, I mean 8 hourly. Now let me explain. There are some drugs. There are some drugs that you must maintain that hourly, that 8 hourly stock. Most of the drugs that are anti-infectives, most of the drugs that are anti-infectives, and some drugs that if they accumulate so much in the system at a particular point in time, they may cause some issues. And this one you must maintain hourly. But this one is more with drugs that are anti-infective, like anti-malaria, antibiotic. These ones you must maintain because you want to maintain the MIC. MIC means minimum inhibitory concentration. minimum concentration that required to be maintained in the system to be able to tackle the microorganism. Beat them head on. That you don't need to go below that concentration. So this one now you must. That's why you see. You take the most of the antibiotic you see proposals seeing 12 hourly, not just BID. No, 12 hourly. Now, paracetamol, you can see paracetamol TID. That's why, even though paracetamol is three times daily, are you aware that some people can? There are some situations you see yourself. You can still take paracetamol within 4 hours interval. So sorry, 6 hours. 6 hours. Maybe if somebody has fever and within 6 hours the person start feeling feverish, the person can still take paracetamol. Are you aware? And the person doesn't even need to finish the whole sachet before the person will say, I am maintaining. You must not finish. Once you take it. You can even take it twice a day and you feel okay. You stop it. Are you aware? But you cannot do it in antibiotic like Cipro. You don't. How dare you do it there? No. Even if you take it, you first dose, second dose, and you feel okay, you must finish at least 5-day course. At least 5-day course every 12 hours for like 5 days. You must finish it. If not, you are inviting to trouble. You are inviting resistance. So these are some drugs that must maintain hourly. They know what they are doing. Something like this hyoscine now. Once the whatever is, they will even take it 1, 2, and they start feeling okay. They will stop it. I'm trying to point out why you may be confused and start picking hourly. The right answer is what? 3 times what? Daily. Does it make sense? Does it make sense?
Yes, sir.
So if it makes sense, let's go to the next question. If it doesn't make sense, let me hear your own opinion. If not, let's go to the next question. Question what?
Question 19.
Oh yeah.
What is the duration of administration of the drug? The answer is B,
Okay.
72 hours. That's 3 days.
3 days, right? Perfect.
Yes.
72 hours, 3 days. These questions are simple. You guys will scatter farm card now. These things are simple questions. That's good. I'm impressed. Number 20. Please wait. Sorry. Please, if you are in this class and there's anything you don't understand, please don't keep quiet. I beg you. Ask. Don't keep quiet. It is called revision. If there are some things you don't understand, don't say it. Don't feel that let me not ask so that it will look as if I don't know what I'm doing. No. Please ask and I will explain. Please ask and I will explain. I beg you. All right, next question. Next question, 20. I read.
Convert 4% to milligram over milliliter.
What's the answer?
A, 0.04.
Explain. How did you get A? How did you get A?
Four divided by 100, sir.
As in see, if I ask you how you got the answer in calculation, just tell me the steps you took. That's what I meant. Just give me the steps you took in the calculation. That's what I want to hear, so that others can also hear the steps you took in the calculation. Yes, break it down. I like the way Ada breaks, even break it down like that. Let's go. You start from telling us what is 4%. But for those that don't understand it, what 4% means. All right, let's go. Hello? Okay, you are solving it. Okay. I solve it. Let's see. The question is from this question want to test your knowledge of metric units. Very important. Want to test how you can move from one metric unit to another metric unit. That's what the question is trying to test. Very important.
Start the 4%.
Okay.
The question says convert 4% to milligram over milliliter. So a 4% actually means 4% weight in volume. It means 4 grams in 100 milliliter.
I agree with you.
Now to convert this 4 grams to milligram, you have to times 6 by 1,000, giving us 4,000 milligram.
I agree with you.
So 4,000 milligram divided by 100 milliliter.
I agree
will
with
give
you.
40 milligram milliliter.
It will give you what?
40 milligram over milliliter.
I agree with you. God bless you. Yes, that's the answer. That's the answer. The answer is what? B. 4% means 4 grams in 100 mil. So 4 grams, you move because you want to move everything so that it will give you milligram per mil. Move 4 grams to milligram. That means you multiply this by 1,000 to get 4,000 milligram. You now divide by 100 mil. Break it down to the lowest distance. At the end, you now get 40 because 100 will take it 20 in 4,000. You are left with 40 milligram over 40 milligram per mil. So the answer is what? D. Is it clear?
Yes, sir.
Good. Next question. Next question, please. Next question. Read the next question. Someone should read now.
Information for questions 21 to 23.
Okay.
Dispense aspirin 80 milligram, paracetamol 150 milligram, caffeine 50 milligram, flat pulvix needed tells the chem.
Fiat Pulvis Meter Palace Dechem.
Okay.
Okay. He's telling you to make the part Pulvis 10. So he's telling you to prepare powder, send 10 wraps. Is that clear? So, continue.
21. What type of powder is in the prescription above? Option A, simple powder. B, divided powder. C, bulk powder. D, dusting powder.
What's the answer?
Divided powder.
Divided powder. We did this in first year now, right? Yes. We did it in our first year. So it's not something new to you. It's divided powder because it's in wraps. Is that clear? is divided in 10 in wraps. Let's continue. Next question. Next question. Is it network issue? And when I'm Chinwe, are you in this class? And when I'm unmute your mic, talk to us. Are you in this class? Hello?
Yes, sir.
Oh yeah, read number 22.
In compounding this prescription, when one dose is added to accommodate transference losses, the calculation and subsequent preparation will be added. How many will be made at, sorry, the subsequent preparation will be made for how many doses? A, 10 doses, B, 11 doses, C, 12 doses, 13, D, 13 doses.
What's the answer?
11 doses.
Why do you say 11 doses?
In the prescription, it was written we should prepare for 10 doses, and the question
Okay.
said to accommodate transference losses. So we'll
Okay.
add 11.
So what do we call that thing you added? What do we call it?
Transference losses.
No, what do you call it? That's the name we call it. That's the name we call what you added to take care of transference losses.
Overage.
God bless you. Now tell me about transference losses. What do you mean by transference losses? Tell me what you know about transference losses. With specific examples. I'm listening. We are listening. Go back to your practical. Say, what do we mean by transference losses? Huh?
Those losses that you see with your eyes that are visible.
That are visible. Can someone else help us? Okay, let us not waste our time. Now, what do you mean? Remember that if you are preparing something like powder now, maybe you use your spatula, you take some from the bar, even at the point of weighing, you take some, put in where you're weighing. As you are taking out the powder, fine. You may not. Some will follow the breeze. Some will just, some of these powders are light. Some may just follow the breeze or little breeze or air and go. Good. Let's assume after weighing, you may not feel it because you have not weighed. After weighing now, you have weighed, say 2 grams or whatever quantity. On trying to transfer that thing you have weighed into the mortar for titration, some may get lost. True of us. What you may have inside that mortar may not be up to 2 grams again, or the required amount. And you add other powders, you titrate. When you don't titrate, even as you are trying to move the titrated mix to the container or whatever to package it, some will still get lost. So all these losses are what we call what? Transference losses. Transference losses. So to be able to accommodate that, because if you actually weigh the exact amount that will give you 10 powders, 10 wraps, if you weigh the exact amount, by the time you are done and you start packaging these powders, you may not get up to, you may get just 10, you may get just 9 powders. If at all, there will be remaining in the 10th wrap, it not even be enough. So to accommodate for that, you prepare, you add something we call overage, but you add your overage proportionally. Don't just add it anyhow. If you add it anyhow, you mess up the whole preparation. You add it proportionally based on the formula you are using. That means you're going to enlarge your formula. Remember what we have to enlarge formula proportionally. You will enlarge your formula from 10 powder to 11 powders or 12 powders as the case may be. When you are done, ideally it can be 11 powder, you can add extra one. When you are done, you will now weigh the exact quantity you need and wrap the exact quantity you need. That's when you can get the exact number of powders you're looking for. So the answer is what? B, 11. Is that clear? Good. I'm trying to refresh our memory in some of these techniques. Okay, right. So with this now, I know I have taken your mind back to your practical so that you appreciate what you are doing and be able to remember what happened during your practical. Because in as much as you're not writing BDP, you're not writing practicals, but some of the questions you see in BDT are practical oriented. Like this question now, this question 21 to 23 are practical oriented. These are what you did in your powder, divided powder practical. True or false?
True.
Number 23, I read.
What is the possible use of this prescription? The answer is A.
Yes, pain-related condition. Pain-related condition. So the answer is A. Now let me ask you a question. Apart from being divided, we have different.
We can't hear you.
I know they see you, Sal.
Categories of powder. We have different criteria for classifying powder. Look at powder. What tell me other transmission, and also tell me popular brand that contains in the market today that contains these ingredients. Popular brand in Nigerian market that contains these ingredients.
Surdress.
As powder. Is surdress a powder? I mean powder, not tablets. Does surdress come as powder?
No.
Good. I mean powder. Very popular.
Running this. Sal, what is the name of the powder?
I'm asking you, asking me back.
Okay, sorry, I thought you have answered it. Sorry.
I said, in Nigerian market today, tell me one popular brand that contains these three ingredients: aspirin, paracetamol, and caffeine. In the market today, I make it this real so that it's not just it's not far-fetched. It's real. Who can tell us? Packaged as individually packaged sachets or whatever. Well, what does halabukun contain? Who knows what halabukun contains? You know halabukun, right?
Yes, sir, we know it.
Have you bothered to check the contents?
To be honest, I haven't.
Please stop looking at drug like lay people. Now you're no longer a lay person. Any drug you see, try to check the content. That's the first thing you should do in any medicine you come across. If you're not been doing that, start it from today. For any medicine that you see with your eyes, try, even if you see it online, even if you see it live, try to find out the content. It's very important. It's very important. I will not say it. It's either you browse it now and tell me the content.
Hello, sir.
Or you go home and check it. I won't tell you. You can check it and tell me.
Jesus, sir. Abakwami in Ekusis. I know you dead, oh. Me too.
Because in the other class, the paper will be though from number 13 or 14. When screenshot today, because send the people.
And please, if you screenshotted one to the number we are now, please send it. Network 24. Thank you.
Once again,
The number we are now.
question from question one. Chat. Oh, na YouTube now.
Okay, that's the link for the YouTube. I did not see it.
Send it in the group.
Again, a group. Why you have to hand chat from yesterday, from Thursday. Sorry.
Are we together?
All right, thank you.
Hello, are we together?
We are not together.
System
You're
again.
connecting.
Hello.
Hi.
Oh. My
Sir, your
network.
network is very bad.
My network. I just left. You guys entered me to no matter.
You are welcome to join.
Chineke.
My network. Okay, please. Where did you hear me last? I thought I thought we were the same class. Where did you hear me last?
You're talking about Alabukun.
Has somebody find out what it contains? Huh? Has somebody find out what it contains? Do it now. Do it now, please. And please, in my class, anyway, you have the data. Very important. Do it now. You can search it in a different window and get the answer. Do it now. It's very important you do it. Do it now and tell me.
So what do you say? What do you say is the name of the drug again?
Alabukun. Sit on the board. Alabukun. Find out what it contains and tell me now. I was talking about
Acetylsalicylic acid and caffeine.
what?
Aspirin and caffeine.
Again, please.
Aspirin and caffeine.
Only.
That's what they wrote here. They also said this combination, aspirin, paracetamol, caffeine, is found in products such as APC plus. For your exam, Father, alabukun is equal to aspirin plus caffeine. But it contains only 2 ingredients.
Okay. Okay. Okay, good. Have you now seen? Is what you're discussing now? Is it making sense? Please, anytime you see a particular drug, please try to find out if not for anything, at least 1 or 2 brands in the market. It's very important. You may not see all this, you may not see it in a normal textbook, but try to find out the brand in the market around you. It's very, very what? Important. I'm talking about simple and compound powder. What's a simple powder? We did this in your ability 152. What's a simple powder?
Powder with 1 active ingredient, Abby.
With 1 active ingredient. What of compound powder?
More.
It contains 2 or
2
more
or
active
more.
ingredients.
I agree with you. So, alabukun powder, is it a compound or simple powder?
Yes, sir. Compound.
Compound. So, the one in the formula above, is it simple or compound?
Compound.
Compound powder.
So we can confidently say that this product is a compound divided powder. Can we say so?
Yes, sir.
Good. Now, next question. 24.
The combination ratio for the formulation of a primary emulsion using a fixed oil is A, 4:2:1.
Is that the answer?
Yes, because 4 is to the oil, 2 is to the water, 1 is to the gum.
OWG. OWG for fixed oil. Example of fixed oil is what?
Arachis oil.
Another example.
Peppermint. Abi?
You say what?
No, you mean talk.
Yeah, thank God.
Cinnamon.
You say what? Okay, see, most of this fixed oil, please, fixed oil are mainly oil from seed. Oil from seed. Arachis oil is there. Olive oil. Are you aware that olive oil is there?
Castor oil.
Castor oil. Hey. Is it making sense now?
Flaxseed oil.
Okay, now, please, find out the ratios for mineral oil, ratio for what is it called? The one that's we have fixed oil, mineral oil, and the one that evaporates. What's it called?
Volatile.
God bless you. Volatile oil. Find out their ratios. No, because by the time you enter into calculation, each of them has different ratio. This one is 4:2:1. What of the other ones?
Volatile oil 1:4.
You say what?
I said volatile oil 1:4.
Are you sure what you're saying?
No.
Yes, that's why we call it the revision. Find it out. Tomorrow you tell me this. Is that clear? Tell
Yes,
me.
sir.
Tell me tomorrow. Go back to your book. Go and dust it again and open it again. Tell me.
Okay, sir.
Question number 25. Fast. 25.
1.5 mil.
1 point what?
Yeah.
5 mil.
1.5 is simple, right?
Yes, sir.
How did you get it? How did you get it? Tell us.
If 10 milligram is equal to 2 mil, how much will how many mil will 7.5 milligram give you? Cross multiply 7.5 times 2 is 14. 14 divided by 10. Sorry, it's 15.
Say it again.
One.
Start afresh.
The answer is 1. Oh. I said how many mil of this thing must be injected from the ampoules labeled 10 milligram to 2 mil in order to administer a dose of 7.5 milligram. 10 milligram is equal to 2 mil.
Okay, I agree with you.
So how many will 7.5 milligram give you? Now x is equal to 7.5 times 2 over 10. 7.5 times 2 is 15. No, it's 10. So let me use
7.5
calculator.
times 2 is 15. If you divide it by 10 to give you 1.5.
Stop then. Thank you.
It's 1.5, right? 15 times divided by 10, right?
Yes.
Yes.
1 point. I agree with you. 1.5 million. The answer is B. The answer is B. Question number 26. Fast. Any confusion here?
The other one.
My system has gone down. Please, tomorrow we'll start from question 26, okay?
Okay, sir.
Tomorrow we'll start from question 26. Tomorrow. Please,
Okay, sir.
I want you to study. Go and continue. You guys are doing well. I am impressed.